Hello and welcome to another edition of Conversations of the Heart. As always, it is your boy T Till. We have a very special guest, an esteemed guest here in the building today. We have Dr. Jade MD out of Las Vegas, Nevada. She is a devoted Christian wife, mother. She is a board certified family medicine physician with additional certification in obesity medicine. She really focuses on wellness and prevention, using the principles of lifestyle medicine and her personalized wellness plan, the Inspire method, to really assist her patients in preventing and reversing chronic diseases. She also has a nonprofit organization called Inspire LV, where she hosts Las Vegas wellness events across the valley. She completed her bachelor's degree in biological sciences from the University of Nevada, and then she obtained her medical doctorate degree from Southern Illinois University and completed her family medicine residency and training in Southern California at Loma Linda University Medical Center. She is an absolute powerhouse. She's also a two-time author, and she is the host of the She Inspires podcast. She's doing a lot, ladies and gentlemen, and we are so incredibly blessed to have her here to share her knowledge. And here she is today, Dr. Jade MD. Dr. Jade, thank you for coming on the show. Thank you, and welcome to Conversations of the Heart.
Thank you so much for having me today. I mean, you did cover a lot. I grew up in the Las Vegas area, and God showed me when I was 4 years old that I was called to be a doctor. That's been my dream. But my dream was to take care of people really well, be the community doctor, to help people get healthier. And I know we'll get into it in this conversation, but throughout my training, throughout growing up in Vegas, we just couldn't find quality healthcare, that we're really in a medical desert. So I knew I wanted to come back and serve my hometown. But then as I learned the medical system, in residency and training, I learned how really people are just, physicians in particular, are just required to do what insurance companies say do, and which leads to less quality care. And thankfully, I learned about direct primary care in residency. And
Mhm.
that was where Inspire Primary Care was given to me. The vision was given to me. And I'm just really thankful to be living my childhood dream of caring for people really well and
Mhm.
serving my hometown.
Absolutely. And that's the one interesting thing that I found out about Vegas, relocating here from New York City. I always had, access to doctors and, hospitals and I could actually see my doctor,
Yeah.
right? And so coming out here, it was like, oh no, you have to see, a different doctor and you can't really see your real doctor, right?
Yeah.
And so that I thought that was odd, right? So I kind of sought out my own direct primary care doctor at the time. And, it really absolutely, changed my whole perspective on medicine, right? Because I've never received care like I've received care from my own direct primary care. So I love and I want to highlight, more doctors like you who want to take this approach. So kind of tell me about, what you do and what you provide as a direct primary care provider.
Yes, for those who are not familiar with direct primary care, it's basically membership medicine. I like to keep it very simple because we all understand memberships, like a gym membership, but for primary care, or like a Costco membership, but for primary care. What has happened in our insurance-based medical system is we've flipped what primary care is supposed to be. Primary care is supposed to be your healthcare home, right? You're supposed to have a doctor that knows you, a team that knows you well. They're supposed to know you by name, what you do. You're not supposed to need to fill out a whole form every single time you go because they know you, right? And
Mhm.
what primary care is supposed to be, we're trained in 90% of healthcare. We're trained with dermatologists to learn dermatology. We're trained with orthopedic surgeons to learn orthopedics, for example. So most things should be done in the primary care office. But what insurance companies learned is that they don't make money in primary care offices, right? If you wonder
Mhm.
why something is the way it is, follow the money, right? And so
Right.
what they learned is, oh, we make our money through hospitalizations, surgeries, or through specialists that do procedures. And
Mhm.
so insurance has flipped it, where primary care is literally just a conveyor belt a conveyor belt referral center. So doctors are required, primary care doctors are required to get in and out the room within 5 to 8 minutes. That is a requirement, or you are
Hmm.
fired as a physician. And that is because they want you to quickly send a pill or a referral or send them to the hospital. That way you're shuttled to where they actually make money. And so the whole point of direct primary care is to remove the insurance from the primary care office, which is 90% of your healthcare needs. Instead, do a simple membership model. And your healthcare team is at your fingertips: text, email, phone, video, or in office. And it's
Hmm.
your healthcare home. And most things we don't have to refer out as often because we're a text away. We get on things early. I have relationships with many specialists. So a lot of times I'll just text my friends and ask a quick question, because a lot of times that's really why we're referring anyway, which just leads to a streamlined quality care.
Mm.
And then what I love about the evolution of this model is people are learning ways to customize their insurance, like the catastrophic aspect of their insurance. Just like car insurance, we use it for
Hmm.
crashes, not
Hmm.
gas, with,
Right.
all the other maintenance. And
Hmm.
so they're customizing that with like HSA high deductible plans so that it complements a direct primary care membership. So it's not that this is something on top of, or something that's for the elite or the rich. It's something that's made for the everyday working professional. And we're just customizing the catastrophic insurance in a smart way to make all of healthcare more affordable and higher quality.
And I love how you did that and how you, because I was going to touch on that because when most people hear membership based, it's
Yes.
like, oh gosh, here comes another bill. I have my gym membership, I got my phone bill, I have all kinds of membership, Netflix, this, and here comes another membership.
Yes.
But what I will say is it is probably one of the best memberships that you could ever have, especially
Yeah.
when it comes to healthcare. And the one thing that I do love about your model is the preventative piece. If you can kind of talk to how important what you guys do, the reason why you guys have this type of care is for preventative purposes, right? And I'm not saying that the other doctors are not, but what I did realize from my own personal experience, and you can correct me if I'm wrong, but I remember, I had no clue what insulin resistance was, right? That
Mhm.
was never
Yeah.
even a part of the language when I would go to my other doctors. It was like,
Yes.
oh, yeah, 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 A1C, it's great, it's good.
Yes. Yes.
Bye, right? And so that could be problematic in terms of if your insulin resistance is high, that means that you're right before pre-diabetes, then which is the precursor to right, diabetes. All of those things. If
Yeah.
you are ahead of the pre-diabetes, like there's care, right? And there's just education, right, that I never had about other things, right? And so if you can't talk to a little bit about why what you do is so important for preventative care.
Yes, I'm super passionate about prevention. One, because we know, both in evidence and in clinical experience, that chronic diseases are not only reversible, but also preventable. And most of the things we suffer from later in life, or not necessarily later in life these days, right? Cancers, high blood pressure, diabetes, cholesterol, most of that isn't necessarily genetic. More commonly, it's lifestyle related. It's what are we eating? How are you sleeping? What are you move? How are you moving? What's your environment like? What's your stress like? How's your financial health? Like all these other aspects.
Right.
And when we're able to really look at root cause, have a relationship, talk about things ahead of time, talk about how symptoms are showing up, and also this most of things don't have symptoms early on, right? So checking
Hmm.
fasting insulin, for example, not just the A1C. Yeah, that's a great example. Or vitamin D. These are things where it's like, let's actually look at things that are commonly that we can commonly look at to prevent. And I like to look at things as like green light, yellow light, red light when it comes to health. Like if you're in the
Hmm.
red light, let's get you to the yellow. If you're in the yellow, let's get you to the green. And if you're in the green, let's keep you there. Because a lot of times people will say, well, I'm healthy. I don't feel like I need a membership for healthcare. And my response is, if you're healthy, my goal is to help keep you healthy for as long as possible, for as many decades as possible.
Hmm.
And so, yeah, I am very passionate about the prevention. But the thing about that, again, is this isn't that direct primary care physicians are so much more brilliant than insurance-based
Right.
physicians. It's just the most important aspect is time and relationship and trust. But time is the biggest thing. And everything you just explained, that takes time. So
Right.
the direct primary care experience you've had None of those conversations and discoveries can come within 5 to 8 minutes. That's pretty
Hmm.
challenging. And so that is what I love is that I'm not rushed. I have time to ask questions. I have time. Here's the thing, medicine is so vast, especially primary care. We go to
Hmm.
school for however many years, but we may see a patient that has something that we haven't studied for years, right? And so
Hmm.
I have time to research and look up the latest articles and what's happened in clinical medicine since I was in training. And those are just things you don't have time for, which is why if you have to get in and out in 5 minutes, it's like I just got to refer you because I have 30 other people on my schedule and I have to see them all in 5 minutes. So, yes,
Hmm.
prevention takes time. And in insurance-based practices, those are actually called non-billable visits. And
Right.
so that means they don't want you to sit and talk about sleep, stress, nutrition, exercise. That's all non-billable. Insurance companies can't get paid from that. So a lot of times people are wondering, like, why isn't my doctor talking about the root cause and wellness with me? It's
Right.
because that's a requirement for insurance companies. You must talk about billable things.
Well, and that's true. And especially when you mentioned time, I remember my first visit to a direct primary care physician. She was like, "Oh yes, 2 hours." I said, "2 hours
Wow.
where?" I was like, "You mean like, am I going to be doing like tests or like certain things?" And she goes, "No, this is a time for us to sit, to talk, and we'll take the vitals, we'll do the things. But I want to know more about like your history." And
So,
I was like, yeah, so like it kind of got my wheels turning like about
mhm.
this model that you have, because I think it can make a real big impact on everyone's health and wellness, right?
Absolutely.
Um, and so one, thank you for being a part of this, especially in Las Vegas. I think is where there is such a huge gap between one, just how many doctors that we have out here,
Right.
right? And then we have you guys who are doing such an amazing job and amazing work. So when it comes to like your journey, I know this is what you've always wanted to do with your life, right? So talk to me a little bit about that journey, right? And that moment where you said it's direct primary care, like versus, the insurance base. Like, what was that moment for you?
Yeah, that's a great question. So I'm the type of person where if it doesn't make sense, I'm not, I'm a go to the beat of my own drum kind of girl. I
Right.
like to fix systems. I like things to be efficient. I like things to make sense. And, that doesn't make for a great employee all the time, It's like show up,
Right.
do the job, right? And
Right.
so in residency training, that was what they wanted you to do. It's like you're here to learn, you're here to do the job and learn how the system is and fit into it.
Mm,
And I just found myself repeatedly being frustrated because I'm like, it doesn't make sense for me to rush this patient in and out. So why am I going to do that? And those are not the questions they want you to ask, or we would spend more time at the computer pressing buttons. So I would spend 5 minutes in the clinic with a patient face to face, but then I would spend 20 to 30 minutes on their medical chart to click all the buttons required by the insurance company just for the clinic to get reimbursed from the
right.
insurance company. So I was like, why am I spending 5 minutes with a patient, but 30 minutes per patient on my
Hmm.
computer? That doesn't make sense. Again, just do your
Right.
job, right? And so
Right.
I was asking these type of questions constantly. One of my most frustrating experiences was there was a patient that came in just for an ankle sprain.
Hmm.
They had an ankle injury, kind of rolled it. They weren't sure if they broke it. We pretty much figured they didn't break it, but because they were limping and it was so much pain, we were like, well, let's just get an X-ray just to make sure. So I already knew the patient. I had seen him before. Went into the place. I knew they were there for an ankle injury. So we talked about the ankle. When did it happen? I did an ankle history. When did it happen? What happened? How much pain? Blah, blah, blah. And so I ordered the X-ray. I come out when you're a resident, you have to come out and present your presentation to your
Hmm.
attending physician, and they approve it. And that's residency training. And so I talked to the attending, and I say, okay, I ordered the X-ray and for the ankle, and they said, well, did you listen to their heart and lungs and their abdomen on exam? And I said, no, they're here for an ankle injury. I
Right.
just got a history of the ankle and examined the ankle and ordered an ankle x-ray. And they said, oh no, we can only bill it as a level 2 if you only did that. But if you actually they were like, every patient that comes in, it doesn't matter what they come for, just put the stethoscope on their chest, on their lungs, and on their abdomen. That way we can at least bill it for this amount. And I was like, they made me go back in the room and say, "Oh, I forgot. Let me listen to your heart and lungs and abdomen." And the patient's looking at me
Hmm.
like, "For my ankle?" And those, so that's just one example of just the
Wow.
silly things that you would have to do and be
Hmm.
required to do for over 30 people back to back to back to back. And that weighs on you because
Mm.
people were coming to me getting sicker and sicker because they couldn't get in for 3 to 6 months. They're trying to call me and get a question answered, but they have to wait on the phone. They can't get through. I would hear a nurse talking about a patient that was calling for me. And I'd be like, just put them through to me. And they're like, oh, no, no, no. You got 30 more people to see. Like, we'll handle it. We'll get them on your calendar in 2 months. Like, so those are the type of things that just did not make sense to me, didn't sit well with me. It didn't feel, my moral
Yep.
compass. It just didn't feel right. And I just thought to myself, I'm not going to be able to do medicine very long if this is how I have to practice. And
Mm.
I'm saying this in my early 30s, right? And I'm
Hmm.
always already thinking about I'm either going to have to leave medicine or God is going to have to give me a different answer.
Hmm.
And so thankfully, I was over lunch. And at that time, all of my colleagues were signing contracts. It was our second year of residency, the beginning of our second year. Everyone was signing contracts because that's what hospitals do. They not prey on, but that's a
Hmm.
part of their sales cycle.
Yeah.
When people turn second year residency in family medicine, they go and recruit, right? And
Hmm.
they try to get you to sign a contract as fast as possible. They give you a shiny signing bonus, all of the things. We call them golden handcuffs in direct primary care. And because once they get you locked into their system, they upgrade your life fast,
Mm.
financially, then you're just stuck into
Yep.
one system or another. And so I was the only one who hadn't signed a contract. And my attending physician was like, what are you going to do after residency training? You're the only one who hasn't signed a contract. I was pregnant with my second baby. And so I
Mm.
knew that I was going to like take a little time off. My delivery was going to be right when training ended. So I was like, I'm
Hmm.
not in a rush. I'll figure it out. We're going to be moving. I was in California. I was like, we're going to be moving back to Vegas and then I'll have the baby and then I'll figure it out. And what I started telling her was just like what I dreamed. I was like, I don't know, because what I really want is to take care of people well, not be rushed. I want people to be able to reach me easily. Like, I was like, I just can't do this. So I'm not really
Hmm.
sure what position that's going to be where I can like have a good life, enjoy my family, my marriage, and take care of people really well. And then she goes, it sounds like you might be interested in something called direct primary care. And I had never heard of that. They don't teach you about it in training, at least back then they didn't.
Hmm.
And I'm a learner. So I went home and I Googled it. And at the time, it was the pandemic. So the medical conferences in the direct primary care space were virtual. So I attended those on my night shifts in the hospital. I was looking at all the direct primary care conference videos. And I was just a sponge. There were a few direct primary care books. At that time, there were like two. So I read those. And then, of course, social media is there. So I started following the doctors online. A couple of them let me like come out. I flew out to their practices and learned from them. And I found a small community of doctors that had started their practices from residency, straight from residency.
Wow.
And so I had a conversation. I prayed on it. I'm a woman of faith. I prayed on it
Hmm.
and I talked to
Hmm.
my husband about it. And I was like, I really believe that God is calling us to open straight from residency. And meanwhile, I'm pregnant with our second baby. My other baby's, a
Hmm.
toddler, little baby. And
Hmm.
he's like, what do you mean? Like, we've been going through this journey for 15 years. He's been waiting for me to finish training so he can, contribute. He's been waiting to be married to a doctor. like I put in all this work and now you don't want to sign a
Right. You don't want to
contract.
sign this
Yeah,
bonus? Come on
yeah,
now.
no, no. And I'm like, nope, God says let's open a business and, straight from residency. We have no, we're starting. And so none of it made sense, but on paper, but it was like a truly crazy faith.
Mm.
And it's been the best faith walk that I could have done. Like I love what we have built with Inspire.
That's a good example of radical faith now.
It
That's really,
is.
really, really good.
It is.
That's awesome. And so I know a lot about direct primary care from being a patient from it and what, the all the benefits that I get, right? But from the doctor's perspective, because you actually mentioned having time to, spend with, your husband and your children, right? What are some of the benefits? Because I kind of feel like in the insurance-based model, it's very churn and burn.
Yes.
And it's probably can be long days, long nights, long weekends possibly, right? So what are the benefits aside from, helping people and
Yeah.
helping your patients, what are some of the benefits from the doctor side of it personally?
What's interesting is when you go into direct primary care, and this is important for any physicians that would be listening, is you are no
Hmm.
longer, if you're opening your own direct primary care office, you are now a business person. You're now an entrepreneur. You're now a
Hmm.
CEO, a founder, which is a completely different hat than being an employed physician.
Hmm.
And so there were two things I had to learn and embrace and figure out where my strengths and zones of genius and what I loved, what pieces I needed to outsource and partner with experts in.
Hmm.
From the more clinical physician part, it was like in the insurance-based office, like you would think a physician, a primary care physician schedule was nice because it's like Monday through Friday, 8 to 5, you're in clinic, right? But what they didn't see was because they double booked your appointments and you were literally back to back. I mean, I would be like I was pumping for my
Hmm.
oldest daughter while I was in clinic. I would be
Hmm.
having my breast pump on, doing notes, like
Wow.
drinking a sip of water off to the next patient because every room I had to go in, I would have to start every appointment with, I am so sorry I'm late because you're already walking into someone who's been waiting over an hour just
Mm.
based on how the system did our schedules. They double booked intentionally just in
Wow.
case someone didn't show up because then they wouldn't lose the revenue. And
Right.
so if both people showed up, you can already imagine the math there. You're behind
Hmm.
all day.
Right.
And that's not something you have control over or to say, no, don't book 30 on my calendar, book 15 or
Yeah.
12. Like
No.
you didn't have that power, right?
Hmm.
And so clinically, obviously designing my own schedule, blocking off, we standard block off 1 hour visits. Our patients can have more if they need more time. But 1 hour visits with 20 to 30 minutes between appointments. So I'm able to look at my calendar day and design that. I have a lunch break built in.
Mm.
I wasn't able to eat lunch. I was able to
Right.
quickly take bites between patient rooms.
Mm.
So now I have 12 to 1 blocked off for a lunch break, which is like that was just unheard of. It wasn't normal then. The other thing is when you have 30 people back to back double booked, all of those notes that I'm talking about that take time to click the right buttons for the insurance company to get reimbursed, that just takes more time than you have between patients. The strategy they try to teach us is to do it in flow in the room, meaning you're not looking at the patient, you're not
Hmm.
really listening to the patient, you're documenting what do you have, what do you need, da, 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 and I'm just at the computer. So they're like, try to do the note in the room, but then you're
Hmm.
not paying attention to the patient. There's no relationship, there's no eye contact,
Right.
and so again, morally, that didn't feel right to me. So I wasn't someone who would do that. I would try to be
Hmm.
present with my patients, which means I was taking home notes or staying late into the
Yeah.
clinic till
Yeah.
8 p.m. And so that burns you out. You're in clinic all day burning through, then you're taking notes home, then you're doing that again the next day and the next day and the next day.
Wow.
So that all of that I don't experience now, right? Like just to have a schedule where it's appropriately spaced, the appropriate amount of patients, enough time to take care of people well, to be present, and to appropriately document after. When I close my laptop at the end of the day, I tell everyone openly, like evenings and weekends are for my family
Hmm.
because we are just a text away. Like in primary care, there's very few things that can't wait till the next business day at 8 a.m. So, I take care of people really well all day. And then weekends and evenings are for my family and for my own health, right? And
Wow.
so to be able to just do that, I work out before clinic comfortably. I do date nights weekly with my husband, my kids. I'm there every night to do their bath time, read them books, do homework, do mommy daughter dates. Like these are just the things. My kids have no idea what it's like to have a doctor mom who is not there for everything, right?
Wow.
Ballet,
Wow.
swim, etc. I'm there, right? And historically, if your mommy was a doctor, you just understand mommy's has to
Yeah.
miss things. And that's
Right.
just not the culture. It's the opposite. They think the norm is to have a doctor mom that's there all the time.
Wow. Wow. And you're shifting the culture, which is a great thing, and it's great for your kids.
Yeah.
Now, I will say there's people that are gonna watch this and go, because everybody's a boss on social media and everybody wants to be
Yes.
an entrepreneur, right? So
Yes.
they're gonna see this and say, Dr. Jade is on. She got a successful business. I'm just gonna go ahead and do this. Right? Like it's easy, right?
Yes.
So talk to the other side. Like, what are some things, right, that maybe you've had to learn the hard way?
Yes.
along the way, right? By opening up your business and things like that, that if it can, kind of pivot someone from hitting the same bumps in the road that you have, right? That just they're not going to take this and just go, that's this is great. It's easy, right? No. What
Yeah.
were some of the things that came up as challenges for you during this journey?
So I'm glad you brought that back, right? Because I talked about the clinical aspects that improved, but the whole other part is the entrepreneur. You're an entrepreneur now. And what's so interesting is thankfully I was like so naive and just so like, oh my God, this is amazing. Like, why doesn't everybody just start a business? Like, what are these employed doctors doing? Like, do they not
Right.
know you can make your own schedule and just get your LLC and get an office and like,
Mm-hmm.
don't they know they can do this? So I'm thankful that like my first year, that was kind of like my mindset. And now
Right.
that we're in year four, wow, I've learned a lot where I now completely understand why this is not for everybody. Entrepreneurship is not for everybody. We're not all called to it. There's a reason that some are called to be employed and to do that really well. And there's a reason some are called to steward a business.
Mm-hmm.
And it's two totally different hats. And so for me, CEO, founder, Dr. Jade, I had to learn that there's a such thing as business development, so I
Mm-hmm.
have to wear my marketing and sales hat. I had to learn sales.
Mm-hmm.
I had to learn marketing. I had to learn how to network. I had to learn how I had to put on my CFO hat at the beginning. You don't have all these people you can pay, right? So I had to learn a profit and loss statement, what EBITDA is. I had to learn last year, we underwent an expansion. We expanded to a second suite. We brought on a team. We hired a nurse practitioner to our practice. Our team quickly grew from me and one assistant to a team of seven, pretty much. And so, because my daughters are on payroll, they're brand ambassadors, so we count them
Awesome.
too. And
Mm-hmm.
so
Mm-hmm.
so because of that, I had to learn, okay, now we have workman's comp. Now we have all these other insurances. Now we are stewarding a payroll that has exploded. Now we have to find capital and what does that look like? And how do you leverage debts in a smart way? How does Walmart do this? So it was just a whole different conversation when you talk about expansion and bringing on team and scaling that even when I just opened and it was just me and it was like people signed up for my membership and I'm like, oh my God, they picked
Yep.
me. It now I have learned that it's a different type of sleeping at night. It's a different type of prayer. It's a different type of fasting that I do. It's a different type of drawing close to God for me that is like, you know what, Lord, you are the CEO of this business. And I submit to what you call me to do in it and how you call me to steward it. And it's just totally different. Um,
Mm-hmm.
I am called to it and I
Mm-hmm.
love it. But now I understand why everyone doesn't do it.
Right, right. And which is good, and which is a good call out. It's just because not everyone is an entrepreneur or needs to be or
Yeah,
has the pressure to be. But if that is you, then know that it's not just, I went through, the schooling and I got my degrees and I can just work. There's a
yeah,
whole other side to the business, and that's what it is. Business development, sales. A lot of people are not they don't like sales. They hate
right,
sales. They hate
right.
it. They hate marketing. They want to just do work, right?
Yes,
So maybe for someone, they might have to hire someone to do that side of the business, right? There's different things that you have to think about when opening up a business model like this too, um,
absolutely.
which is great. So talk to me a little bit about your nonprofit, Inspire LV. Tell me a little bit about it.
Yes. So my husband, again, we are people of faith, and we always knew that as we built a for-profit business, that we always wanted to have a nonprofit side of our practice. We've always been
Hmm.
called to serve in ministry, and my husband's a pastor. And so we were always called to serve in different areas. There's different areas we knew we were called to serve. One of those is with marriages. So
Hmm.
early on, we kind of started with small groups and meeting with people at our home for like Bible studies, but then that transitioned into Valentine's Day. We would host something called the Lover Soiree for married people. It's like a community wedding reception for married couples and really just trying to
Hmm.
pour into families. And it's so interesting how I'm a family medicine physician and how God just so beautifully aligns just pouring into marriages and then pouring into children and just healthy family on both sides, both the business and the nonprofit. I also knew that I always wanted a philanthropy side of Inspire Primary Care itself,
Hmm.
the medical aspects, because I do understand that even if membership is considered affordable, and now we partner with many businesses on our corporate side where they will offer us as the healthcare benefit to their employees, which has really opened it up for more people who may not have felt like they could afford it. But I always knew I wanted to have a way to give away memberships, right? And so
Hmm.
now, once we created our 501(c)(3), one of our programs is We Inspire. So we have different programs under
Hmm.
Inspire LV. It's actually Inspire Ministries, and Inspire LV is our marriage and family program. And We Inspire is our medical mission side, essentially. So we're able to gift free memberships when people donate to that 501(c)(3). We gift free annual memberships to adults and children in need. And then this summer, we're going on our first medical mission as a practice
Wow.
in the Dominican Republic. And so we're excited about that. So yeah, we're just always trying to serve in the ways we're called to serve. We were able to do Pickle and Pink last
Hmm.
October, where we were able to raise money. Everybody came out, played pickleball and pink, and we were able to raise money for free mammograms for women in the community. So really, I just pray on, hey, Lord, how do you want us to serve? And then we create different programs under our 501(c)(3) in our areas that we're called to.
Wonderful. That's awesome. And I appreciate the work that you're doing. You and your husband seem like you guys are really doing a lot for the community. And, and it's also awesome because it's the Las Vegas community. A lot of people want to get up and, they move, they don't come back,
Yeah.
right? But you're actually actively doing it in the community where you grew up in. So that's really awesome. When it comes to children, right? So here's the one thing I always wanted to know that I wanted to ask a direct primary care physician. So most kids, they have children doctors and pediatricians and things like that. Um, in my mind, I was like, why would I want that when I can also, have kids to have my kids in direct primary care as well, right? But pediatricians might offer different things, they specialize in just different things. Um, what do you guys provide for children that
Yeah.
might be a little different or similar to a pediatrician?
I love that question. I haven't been asked that question before. That's a really good one.
Mm,
So, the first thing to know is what specialty your direct primary care physician or provider has. Like what is their specialty? Because not all primary care physicians are the same specialty. So,
mm,
my specialty is family medicine,
right.
which means I was trained to take care of adults and I was trained by pediatricians with pediatricians to take care of children, right? And so, however, pediatricians versus family medicine residents, we typically rotate. Although I did do PICU and some of them were sick children, I will say that pediatric residents, they get far more in-depth training on sicker children. So children with more intellectual disabilities, children that have trachs, children that have just a higher level of hospitalization acuity and surgical acuity, right? Family medicine, we do get some of the sicker children in our training, but we definitely got more of the healthy, well child visits, sports physicals, urgent care needs for children,
Mm,
right? So anytime a child is or a parent is looking to join and enroll their child, I always just make sure that they aren't a child that is outside of the scope in which I was trained for, just a much sicker child. I personally wasn't trained for. And so I would refer that child to definitely see peds because they are going to have more in-depth training on sicker children.
hmm.
So that's one thing. The other thing is the scope of services, right? So, meaning I don't do home visits. Some pediatric direct primary
Mm,
care, they, especially if they see a lot of newborns, a lot of them will go and do home visits. And that's just really a part of their business model because like the kids are in that 0 to 6 month phase and they just don't want parents to have to come. They're like, my whole business model is to go to you.
mm,
Versus my business model is really built for busy professionals their children and their parents, right? So it's like busy professionals 30s to 60s. They want to text, email, phone, video. They're busy. And because they're busy, they have children that they want to get taken care of quickly. And also, they have aging parents and they're like, let me help mom. I know how to do the Zoom. So it
Mm.
just depends. It just depends. Versus if you see an internal medicine physician, different than a family medicine physician, they are not trained in pediatrics at all. They're also not trained in pap smears and some of the women's health procedures. So the scope of what they offer in their direct primary care may be a little bit different. So
Wow.
just that those are some questions to ask. And then also usually pediatric direct primary cares, they will offer in-house vaccines
Mm.
versus in a practice like mine, I take care of mostly adults, much smaller population of children. Vaccines come in bulk. And so if I ordered vaccines in-house, they would expire. So we partner with the health department, and that's where our kids get their vaccines, or they'll get it through like their pediatrician and see us for everything else. So that makes us a little bit different than a pediatric direct primary care, where vaccines, if you want to vaccinate, is in-house typically. So just a
Mm.
few little nuances, and that's because all they see is kids, so their
Right.
vaccine won't expire.
Mm. Awesome. And I appreciate that distinction. Thank you.
Yeah.
So you also have a certification in obesity medicine,
Yes.
right? Now, of course, America is there's a high percentage of people that are obese, right? And the range of obesity sometimes seems a little unfair, right? It just because like they have these numbers that go from it's like here to then, of course, a bigger scale. But it seems like sometimes when somebody says someone is obese, it's like really like I'm not even that big, right? So, but I thought it was pretty awesome that you had that certification because I've never seen that before, right?
Yeah.
So, what kind of services or are there extra services that you provide to kind of combat obesity?
Yes, definitely. So, I'm really passionate about, I don't love the term obesity, although by medical definition, that's
Right.
what they classify it as, right? But in my practice, we call it your healthy weight range.
Mm-hmm.
So, and for me, your healthy weight range is the weight range where one, you feel your best. Like when you look in the mirror, you feel good. It feels good on your clothes. When you're walking
Mm-hmm.
around, you're not out of breath. You're not snoring at night because you got all this weight on you. Like, so we know what weight range that
Mm-hmm.
feels good. Like your knees aren't in pain because you're not
Right.
carrying extra weight, low back pain, etc. So one, we know what that range typically feels like, where we're like, oh, this feels like a healthy weight range on me. And then the
Mm-hmm.
second part of that is where our chronic disease burden is in a healthy range, where our blood sugar, cholesterol, blood pressure, all of that looks healthy on vitals and labs. So that
Mm-hmm.
combination is what I call the healthy weight range. All right. Versus just looking at a BMI, which takes your height, takes your weight, doesn't take into
Mm-hmm.
consideration your muscle density or the proportions. Like if your fat is around, adipose tissue is more around your midsection versus if
Mm-hmm.
it's a little more in your hips, but it's muscle. Like it doesn't take these nuances into consideration.
Mm-hmm.
So I look at healthy weight range with our members. And so that was something I wanted more in-depth training around. In Loma Linda, we were trained in, it's a blue zone, which just is like the areas in the country where people live the longest, typically into their hundreds. And
Mm-hmm.
usually it's because of their lifestyle. So we had a lifestyle medicine program built into my residency training, which was one part of my reasons for wanting to go there. But I just wanted more in-depth training around how do we actually combat obesity? How do we actually create custom wellness plans around this? And if there
Mm-hmm.
are any additional tools, medication or no medication, I didn't just want people to be going on TikTok or ordering things offline. And because, hey, it's cheap, they said I can get it. I wanted their physician to be a person where it's like, hey, we have quality, of course, GLP-1s and weight loss medications. We have those and we know how to train and do it safely. Um,
Mm-hmm.
and if you are going somewhere else, I wanted to be able to be trained on how to take care of complications because
Right.
that's a lot. And then also how to look at the weight loss phase versus the weight maintenance phase because we're not just trying to help people transition to a healthy weight. We want to help them maintain it. So
Mm-hmm.
all of that just required some extra training that we didn't standardly get in our residency training.
Yeah, awesome. There was something that I saw it was interesting, like when I saw on your website. It's something small, but it made me laugh because of how I always thought about this thing. And this is the one tiny thing, and it goes back to wisdom that your direct primary care can provide you with. So it was the skin tag removal, right?
Sure.
I laughed about it because I, when I was going through that a couple of years ago, my doctor said, "Yeah, listen, oh yeah, if you don't want me to take care of that, just let me know." I said, "Take care of what?" She the skin tag. I said, "Oh no." I said, "Skin tags and moles, you can't touch those." I said, I'll bleed to death."
Oh, wow.
She was like, "What great grandmother told you this?" And I was
Right.
right, and I was like, what do you mean? And she was like, "We can take that, we can take that off. It's no
Hmm.
problem." And so I say that to say, a lot of times these are the education. Even though they're small, but
Yes.
it's stuff that people have grown up with
Yes.
for years and years, and then you tell your kids, and then they tell their kids, right? But some of the stuff, and that's small, but it could be something a little bit more detrimental,
Yeah,
right? Like some of
absolutely.
these things that have been passed down, I mean, especially in our community, sometimes can be a little bit detrimental in lack of knowledge, right? And sometimes my fiance has a favorite scripture, and she always like, "My people, my people." She says something for lack of knowledge. And my people perish for a lack of knowledge, right? Like that's her
Mhm.
thing, right? And it's
Mhm.
like, and it's true, right? But it's stuff that sometimes that we're given, right?
Yeah.
And when you have a doctor that even in that small thing can come in and I got all my skin tags removed, right? But it's like the knowledge of certain things, and that's what you guys provide, whether small or big, right? That's kind of what you do is you educate a lot of us. So we appreciate that. Um,
Yes.
and the last thing I want to talk about, you're also an author.
Yes.
You do everything. Like Dr. J does everything out here. So I want
Not
talk to me
everything.
about
I
these
can't
two
sing.
books. Talk to me about these books. Tell us a little bit about you can call me queen and you can call me king.
Yeah, thank you. I love that question. Yeah, God knew not to give me like a amazing vocal range because
Hmm.
then y'all wouldn't see me in this clinic. So he didn't give me all the gifts. I was like, you couldn't make me sing. Um,
Hmm.
so yes, I really just solve problems. And God just blows my mind and what he does with it from there. So our books were born out of my frustration with the books I was reading my daughter, my oldest daughter, Ava, when
Hmm.
she was a little baby and it was time to read her nighttime books. And they market a lot of the princess books, which nothing wrong with them, but the message was like she was a damsel in distress, and then the prince came along, and then her
Yeah.
life was better because of him. And
Yeah.
and I didn't really love reading those to her as a child. Yeah, sure, she's like older now, so sure, let's
Hmm.
put on the princess dress, the crown. Sure, let's play
Hmm.
pretend, no problem. But it's something about those ages where you're first putting in to their mind who they are, what they can be, what they can do, their scope of the world. I didn't like reading those type of books to her at that stage. And then on the flip side, I just found myself going on Amazon and just ordering these different type of books. Or I would order from, Black authors transparently, and then I would just see
Hmm.
only Black characters. And I was like, okay, well, that's important, but that's not how the world looks. That's not how Christ's eyes are. It's not just Black. It's not just white. It's not just a girl that's a damsel in distress. So I just kept complaining to my husband, like, this book only has this or this book only has this, and he finally was just like, well, just write your own. And I grew up writing poetry, and I as a child I was entered in poetry competitions. It's always been a passion of mine. I grew up loving Maya Angelou, and so God just gave me this poem, really. And it was the words to the book, You Can Call Me Queen. So it just rhymed, it flowed, and he literally just downloaded it to me. And I was like, oh, he gave me a book idea. And then at that time, we didn't have AI or anything. I went on YouTube and I was like, how do you write a self-published children's book? And I just learned from YouTube University. And then I
Hmm.
went on Amazon. I put everything in it in the format that it needed to be, and I ordered it. And it was just for Ava. I put a picture of her on the dedication
Oh.
page, and I was like, and it was like, you can call me queen. And it was just beautiful, diverse characters. The message was you can do and be anything. And that was really
Hmm.
just what I wanted her to be, what to be instilled in her early. And
Hmm.
then it just grew with these mom groups, like seeing me, because I posted pictures of me reading it to her. And then
Hmm.
people started requesting for me to send it to them. Then I started sending signed books to people. Then I opened it public on Amazon and we started selling. And then my at the time I was in residency, and the head of pediatrics, word got out to the head of pediatrics department, And they reached out to me and said, we're going to buy books for the whole pediatrics department. And when children leave, they're going to have your book in their hand. And so it blew my mind. And then I started having boy moms ask me if I could write a boy version. You can call me King.
Mm.
And that was right when I found out that my second baby I was pregnant with was a girl. And I was devastated because I wanted a boy and it was my second girl. And I was just like,
Yeah.
I don't have no boys. I'm not writing no boy book. I was like in
Right.
my feelings about it. And my husband was like, well, just write it for me, you know? And so I did. I wrote You Can Call Me King, and he's a little cartoon character on the cover with a little boy.
Hmm.
And it was really beautiful. And so now we have a boy and a girl version, but now I'm a little stuck. I feel obligated to do a third because I have my oldest daughter in the You Can Call Me Queen book, and I'm like, at some point she's gonna realize her face is not in a book.
Right.
So I think I have one more in me just for
One
Aaliyah.
more. Okay.
And that'll wrap up the series for children's books. I think I'm really being called to nonfiction books for,
Yeah,
adults going
adults.
forward. Yes.
Absolutely. And we'll be on the lookout for that. So tell everyone where they can get the book. I know you said Amazon, right?
It's on Amazon.
Okay.
Yes.
Wonderful.
I used to have a website when I sold and shipped them, and that season,
Yeah.
has come to a close. But yeah, it's on Amazon. You can call me Queen and you can call me
Hmm.
King. And I think they're just so beautiful. I actually
Yeah.
heard Ava reading it to her sister yesterday
Oh, that's
to
so
bed,
cute.
and it just
Uh,
melted my heart.
That is so cute. Tell people how they can get in touch with Dr. Jade. Because we want to flood your subscriptions. We want to get people, especially in the Las Vegas area, the best possible healthcare possible. So tell people where they can find you.
Thank you so much. So, social media wise, we're on Instagram and TikTok, but we're at Dr.
Hmm.
Jade MD. So, DrJademD. Our practice is on Instagram at Inspire Primary Care. We spell Inspire with no I in the front. And then my website is inspireprimarycare.com. And that, again, no I in the front of Inspire. And that website has everything you need. You can enroll there. It has the number to text us. You can text our team. We're happy to answer questions. And speaking of expansion, we're not only now serving the Las Vegas area where our physical locations are, but we're also now licensed for telehealth in Illinois, Missouri, Wisconsin, and Florida. So
Wow,
yeah, so
congratulations.
it's just a blessing, and I'm thankful to serve.
Wonderful. And we'll leave on this note. I know that God doesn't see color and things like that, but the one thing I do know that the world does in a lot of different ways. But the
Yes.
one thing, as I can say, is that there right now is going to be a little girl that's looking up at you besides
Mm.
besides your lovely daughters, right? And you're an inspiration to them,
Oh,
right?
wow.
Just because you're like, oh wow, like that's you know she looks like me. Even myself,
Sure.
right? I'm 41, right? Ever as much as I've been to the doctor in my life for just regular things, I think I had one or two doctors that
Yeah.
look like me,
Yeah.
right? And so, even being in the profession, there's someone that could be a little girl that had your same exact dreams, but may not have someone to look to, and then
Wow.
they might see this, or they might just see you on social media. Can you speak to them and women in general, and just kind of just give them a little bit of hope or some guidance? Because I do think you're a great role model for women.
Wow. Thank you for that. I really just believe in the message that you can do and be anything. Like it really starts in the mind
Hmm.
before anything. So many of us talk ourselves out of it or we haven't seen it done before. So much of what I have been called to do, I haven't seen a blueprint and I haven't seen a blueprint for someone who looks like me. So even that's not an excuse, right?
Mm.
Like if God shows you that you can do something or that you're called to do something, like the first step is believing it.
Hmm.
Like none of it made sense. My parents, no one in my family went to medical school. I had no doctors in my family. My dad was a car salesman. My mom was a teacher. People were like, you don't come from money. Like they're not going to be able to afford medical school. God made a way for a full ride undergrad scholarship, a full ride medical school scholarship, and things I couldn't have predicted, right? All I knew was he told me to be a doctor. I'm going to just walk and walk by faith. And so I think the first thing is just believe you can do it. My scripture, my mantra scripture for myself is in Philippians 4.
Hmm.
I can do all things through
Okay.
Christ who strengthens me. And so
Hmm.
that is something I still to this day say to myself all the time, even when it came to like expanding, hiring people, doing the things I'm called to do now. I'm like, you know what? I can do all things through Christ who strengthens me. It's not coming from my strength. I'm not doing it in my own strength. And in addition to that, you do have people that you can connect with on social media, even if it's just not necessarily picking their brain all the time, but just like watching. Like so much is just like
Hmm.
observing, like, okay, wow, okay, these are the type of rooms she's in. These are the type of steps she's taking. Oh, she has a podcast, she has a book. Not necessarily saying me, but anyone you are thinking about, actually observe and learn and connect and look for mentorship. And so there's just so much, so much. But I really think the root thing is believing that you can do it, regardless of how crazy it
Hmm.
sounds. Like me opening a practice straight from residency,
Yeah.
first of all, me being a doctor, then, that came to light and they're like, okay, she can be a doctor, apparently. And then it's like, but open your own practice. Well, and
Yeah.
you have two kids and you have a husband and you don't have like a savings. Like how, like none of it makes sense. But I believed God.
Absolutely. And shout out to your mom. I know you just said that she's a teacher.
Yes.
Teachers are very underappreciated and stuff
Yes.
like that. So shout out to the teachers, teachers out there in the world. We need y'all. Believe
Yes.
us.
All the women in my family are teachers.
That's really beautiful. Well, listen, Dr. Jade, I won't take up so much more of your time, but just thank you so much for sharing your knowledge, your wisdom. And I know that there will be people out there that will be blessed by it and now have a newfound respect for direct primary care. And thank you so much for having this conversation with me.
Thank you so
Appreciate you.
much for having me.
Absolutely. Take care, guys. We'll talk to you soon.